We are Group 1B of BSN3F, and we are presenting confidence and perceived level of competence towards simulation laboratory exposure among nursing students.
I am June Christopher CUNANAN.
I am Bernadette DURAN.
I'm Alphonse Jacob Estrella.
I am CLYDE Fernandez.
I am Nicole and GAMAO.
And this research poster presents simulation laboratory experiences, which plays a vital role in nursing education by providing a safe and controlled environment where students can practice clinical skills. These experiences help bridge the gap between theoretical knowledge and real-life patient care. Developing both clinical competence and confidence is essential for nursing students to perform effectively in clinical settings. This study explores how simulation laboratory exposure influences students' perceived competence and confidence, as well as the relationship between these key variables.
For the purpose of the study, this study aimed to determine the confidence and the perceived level of clinical competence towards simulation laboratory exposure among Level 3 and Level 4 nursing students of the University of St. LaSalle. Specifically, the study sought to identify the respondents' demographic profile, determine their level of confidence, and perceived clinical competence, and establish the relationship between these variables. For the method section, the study utilized a quantitative descriptive correlational research design. This design was appropriate because it allowed the researchers to measure and describe the level of confidence and perceived clinical competence of nursing students towards simulation laboratory exposure. In addition, it helped determine whether there was significant relationship among the selected variables in the study.
For the study sample, the respondents consisted of Level 3 and Level 4 nursing students enrolled at the University of St. LaSalle College of Nursing during the academic year of 2024 to 2025. A total of 202 respondents participated in the study. To ensure proper representation from each year level and section, the researchers utilized stratified random sampling in selecting the participants. For the instruments used in the study, the researchers adopted two standardized questionnaires. The first instrument is the Student Satisfaction and Self-Confidence in Learning Scale, or SSSCL. This tool was used to measure the level of confidence of nursing students towards simulation laboratory exposure. Specifically, it assessed the students' self-confidence in learning, performing nursing skills, and applying knowledge during simulation activities. The instrument utilized a 5-point Likert scale for the interpretation of respondents. The second instrument is a nursing skill laboratory as milieu of clinical learning and practice. This standardized tool was used to determine the perceived level of clinical competence of nursing students towards simulation laboratory exposure. It included the domain of system, checklist, scheduling, and equipment and supplies. Furthermore, it assessed the students' perceived competence in psychomotor skills, communication, and clinical performance during simulation laboratory exposure. The instrument utilized a 4-point Likert scale for interpreting the responses.
To proceed with the results and discussion of the study, the participants consisted of 55.4% Level 3 students and 44.6% Level 4 students, 112 for Level 3 and 90 for Level 4, with a dominant female population in this study. For SOP number 1, or the demographic profile, the participants consisted of 202 third and fourth year nursing students with varied distribution in terms of age, sex, year level, and section. The data showed a diverse and representative sample of students with simulation laboratory exposure. SOP number 2, the level of confidence. The nursing students demonstrated a high or a very satisfactory level of perceived clinical competence in relation to simulation laboratory experiences, indicating effective development of clinical skills in a controlled learning environment. For SOP number 3, or the perceived level of clinical competence, the students exhibited a high level of confidence in performing clinical skills after simulation laboratory exposure, reflecting improved self-assurance and readiness for real clinical situations. For SOP number 4, or the relationship between the variables, there was no significant relationship between confidence and age, sex, and year level. However, sections showed a significant relationship with confidence, indicating differences across sections. For SOP number 5, or the relationship between competence and demographics, there was no significant relationship between perceived competence and demographic variables as seen in the p-values below. For SOP number 6, or the relationship between confidence and competence, there's a strong positive and significant relationship between confidence and competence, indicating that higher competence leads to higher confidence.
For the conclusion, nursing students demonstrated high confidence and highly competent clinical competence toward simulation laboratory exposure. The findings emphasize that simulation and technology assisted learning enhance students' competence and carrying abilities, which progressively develop through repeated exposure, practice, and experiential learning. Simulation laboratory exposure effectively prepares students for competent and compassionate clinical care. A significant relationship was found between confidence and perceived competence, showing that higher confidence is associated with higher competence.
For our recommendations, the College of Nursing enhance simulation laboratory facilities, equipment, and learning resources to improve clinical learning experiences. The clinical instructors and nurse educators strengthen simulation based teaching through realistic scenarios, demonstrations, feedback, and reflective learning. The nursing students actively participate in simulation activities to further develop confidence, competence, and critical thinking skills. And lastly, to the future researchers, conduct further studies with broader populations and additional variables related to confidence and clinical competence.